I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered, bringing to you once again the stories out there that you may be very familiar with because it's your story about your health. And why do we do it this way? Well, it's different than the podcasts out there that are talking about or lecturing you about all the things that you can do or can't do. But my challenge with all of that, and as educated and informed as I am, I'm quite confused whether any of this stuff is relevant for myself. You see, there's so much content, but it's also that content has to be context dependent. It has to be right for you. So rather than just, promoting a product or selling a service or a person, what we're doing with you today is sharing with you the process by which you can make better decisions for yourself. And how do we actually do that? We do that through role playing. As one of my guests will present with a particular problem, and the other guest will guide them to some form of resolution. And you get to witness yourself in that process and recognize that there is a solution out there. It may not be the one for you today, but just think of it this way: is the way to think about making the decisions for your health. That's what this is all about. And so it's with great pleasure that I introduce both Dr. Matthew Ormand and Andrew Eng today on this podcast, delivering to you the insights and possible or potential action steps that you can take to help you optimize your health, whether it's, understanding now with clarity that yes, there is hope, there is a solution, and, it's definitely worth acting on versus just being hopeless. And as Andrew shared with me earlier, shifting hopelessness to hope, that's the key that these amazing people get to do with you today. So Andrew, please introduce yourself. We'll follow that up with Dr. Matthew Ormand, and we'll go into a short, 6 to 8 minute role play, and then we'll unpack all of that so that as a listener and viewer, you'll get the information that will make the difference for your life. Andrew, thank you so much for joining me today.
Thank you. Thank you, Dr. Bart. Pleasure to be here on this platform with you today. This is a lot of fun. My name is Andrew Eng. I'm a motivational speaker and holistic health coach. I have a background as a licensed acupuncturist, deep tissue massage therapist, and energy healer. I help holistic healthcare practitioners learn how to heal themselves so that they can more effectively heal others. I also have a background as a professional dancer and martial arts acrobat. So I have an extensive experience in physical movement and the application of movement to our practice, because our practice is a form of movement.
Yeah, and the kind of work that you do is instrumental. It's one part that I think a lot of people do forget, even our colleagues out there, Dr. Matthew, as far as, lack of movement and all those things, but energy as well. So you do great work, Andrew, and thank you for that. Dr. Matthew Ormand.
Thank you very much. Great to be with you both. My name is Dr. Matt Ormand. I'm a chiropractor by training, studied acupuncture, meridian therapy, kinesiology, but I find myself in this holistic space. Really, I started out as a sports chiropractor. Love working with athletes. Movement was an important part of my practice. As I kept growing in my practice, I saw more and more adult patients coming in with more complex problems. And as I started learning to unpack the complexity of these problems, I found stress to be the key within it all. And so for the last 17 years, I have been studying profoundly the physiology of stress and learning techniques and methodologies to unlock stress from the nervous system and restore balance, restore harmony to the body.
Great. And it's all about harmony, and the work that you do is absolutely amazing, Dr. Ormand. We need more people like you. We need more people like both of you. So, Matthew, go ahead. You have the problem today, and Andrew is going to be the guide.
You bet, you bet. So, Andrew, in my full-time clinic, I see lots of patients. It is a physical movement. I'm doing body work, chiropractic, using acupuncture in my practice. And what happens is there's fatigue that follows me, pain, almost to the point of chronic pain, where I get massages on a weekly basis. I get adjusted, I get worked on with treatments on a weekly basis. And yet I feel like I'm still not getting the resolution that I'm hoping for. And what I worry about is I don't know how much longer I can keep doing this thing. I'm not done yet with my career and serving people. This brings me so much joy, but keeping my physical body healthy is what really has me coming to you today.
Well, thank you for sharing. Thank you for helping all the people that you do. And yeah, I feel you on that, feeling like you need a little bit more help. And great job going to get massages and going to get some self-care for yourself. What does that resolution look like for you?
So, well, my experience has been after getting some treatment, I do feel better. You know, a day or two time, I feel better, but it's not lasting. And so, resolution, I want to feel good. I want to wake up feeling energy, moving throughout my day, and still have energy left over for my wife and my family. And so that's what resolution looks like for me.
Beautiful. That's amazing. You know, the thing about getting massages and treatments and you feel better for a couple days, I call that the window of opportunity. So imagine that when you get a healing treatment, it opens a window of opportunity where you feel better. And sometimes we may feel worried or scared that the window closes. Like, oh, why did the pain come back? I don't understand why. So the trick here is to, when that window opens, then we practice self-care techniques and adjust some habits, adding good habits, removing any unnecessary habits. And this is how we can create the scaffolding that keeps that window open so that ideally how you feel after a treatment is your new baseline and how you feel for the rest of the time. So tell me, doctor, what are some of the self-care practices that you currently employ?
So that's a good question. I'm so busy with my practice and my family. There's not a lot of, I pay these. I have an amazing body worker that I pay that does good things for me. And then, she tells me to drink water. And so I certainly do that, but I can't say I do much else.
Okay. Drinking water is definitely important. What areas do you normally focus on when you're getting body work?
So typically hips, pelvis, shoulders, and neck.
Mm. Yeah, definitely. Very common. You know, neck and lower back pain are some of the highest percentage things that I've seen in the clinic. And so there are many self-care techniques that can help with that. One of them being, I hear that you get body work. One of my favorite tools is using a ball to give yourself a massage. And I understand that there are a lot of videos and knowledge about this on the internet, but there's another level that we can employ. So a ball is about the same size as an elbow. And so one of the first things that I would do if you came to me to see me on my table is I would see where the tight spots are, and then I would get in there using my hands, and then eventually my elbow to apply pressure to loosen the muscles and give them a chance to relax. And so on your own, when you learn how to use a ball to press on those same spots that your massage therapist did, then you're able to replicate and give yourself a similar type of treatment. I say when you learn how to use the ball, it's like a free massage for the rest of your life. Whether it's 2 in the morning or 6 on a Sunday, you will always have access to healing, so that whether you're on vacation or your practitioner is on vacation, you will still be able to get that relief. And it's like doing the homework in between so that when you go back to your massage therapist, you don't have to work on the same stuff every time. You can get to the deeper layers. And that is the magic of self-healing and how you can really save time, money, and energy and get the most out of your healing treatments. Now tell me about your exercise. Do you have any chances for exercising outside of your practice?
I do. I like to use bands. So I do upper body and I do lower body. So I take one day on, one day off with upper and then on to lower body. So I lift. I like resistance a lot.
Excellent. And how is your flexibility?
Not good.
Mm. Have you had any experience with stretching or anything like that?
Yeah, so I do participate in yoga on occasion, and I like the concept of yoga, but I'm reminded very quickly that I don't move well, and so that's I'll dabble in yoga, then pull back out.
Mm. And have you experienced any benefits from stretching?
Uh, yeah, nothing long lasting. I was a soccer player for much of my life, played collegiate soccer, and so I mean I saw the value during those times for sure.
Yeah, see, stretching is another fantastic tool that you can easily employ. But it's not just stretching for stretching's sake. I think we hear this a lot, that stretching, oh, we got to stretch, right? But sometimes when you try to stretch, there's a blockage and it feels like, it feels almost dangerous to continue stretching. So I'd rather just not do it. And that's how you can compound the effects of your massage treatment and getting the ball. Because when you feel a blockage with the stretch, that means that there's an adhesion in the muscle that needs to be taken care of. And that can be opened either by going to your massage therapist to open it for you, to open that window of opportunity, or you can open the window of opportunity yourself using a ball. Then from there, you're able to then get that range of motion with your stretch so that it doesn't feel dangerous and you can really lock in the results. So I found that a great pathway for this, a strategy, if you will, is to do some self-healing before a healing treatment. You're preparing yourself for the massage therapy treatment versus going in cold. So you prepare yourself, get the treatment, and then afterwards, during that window of opportunity, you employ the self-care practices. Then it will be so much easier to stretch and get that benefit that you felt in those soccer times without feeling like you have to break through so much tissue at the time. And that will help lock in your results and help you to adjust your posture more easily. How's this all sounding for you? Does this resonate? Does it sound useful?
Yeah, I came into this conversation looking for what's missing, right? Like I just didn't feel like I was doing all I knew how to do, but I feel like it wasn't getting to where I wanted to go. And what you've offered is the missing link. Here's what's missing: is the opportunity. That opportunity window is opened, and I'm just not stepping through it. And so this will be great. I will absolutely incorporate your suggestions.
Great.
Excellent.
Good job, guys. I'm going to start off with you, Andrew. What was that all about for you?
I guess it was seeing some common issues and just giving some basic advice on some of the first stepping stones that seem like there's an understanding of, yes, I should do this or I should do that. That's very common in the marketplace, but just offering a cohesive tie-in, just aligning things. Try it like this, using this framework, and then oftentimes just offering some simple nudges of piecing some things together. Oftentimes I'll see the light go off like, oh, I could do that. Tell me more about how I can learn more about these practices and piece it all together.
Awesome. Matt, what was that for you?
So super cool. I think it's so important, and I see the value in offering more information and knowledge to people. Of it's not only just to check the box and go to the massage or go to the whatever treatment, but then there's a knowledge. There's actual principles and laws that are in play here that as we learn to piggyback or like optimize how the physiology responds, now we can step into deeper healing. And the deeper healing, it's not just pure woo-woo, that it follows the line of physiological law. So I love that you unpacked that with us today.
So I mean, I'm going to add on to that, and the truth is that I think a lot of people have abdicated the responsibility of their own health upon doctors to give them all the solutions and the drugs and the surgeries, when in reality, we have to be responsible and accountable for understanding what's available to us and then actually doing it. And I thought it was interesting what Andrew was sharing, which makes a lot of sense, is, rather than just relying entirely on a massage therapist or body worker to do the work, do the prep beforehand and do the work afterwards as well, because that will actually magnify, the results. And so it's critically important, for all of us, to take ownership in our own health, to find out what's actually possible for us, and then and actually apply it. So I'm giving the mic to you guys. So what else would you like to add?
Matt, go ahead.
Oh, perfect. I was going to say the same thing to you. So that's something I'll kind of open up the curtain a little bit. That's something I've done since early on in my practice. Is I did have alignments with massage therapists. I'd get worked on once a week, and I found it was actually I do once a month. I apologize. And I found it was so interesting. Every time she would find something new on my body. And so for the next 3 weeks, that was the area I'd focus on. I'd stretch that area. I'd use percussion tools and various techniques. And what was interesting is the next time I'd come back in, she'd find something else in my body. And so I found that pattern to be so constructive to me, because these things are hidden in plain sight. And without the help of a good body worker, I think we don't see them. But once our awareness is brought to it, I spoke about dentists a while back, but dentists have used their dental hygienists. Every 6 months you get your teeth cleaned, and dental hygiene drives a practice, and it's preventative care, saving patients a lot of pain and some money. But I incorporated that concept into my office. I had a body worker, and we had a recall schedule every 3 months that people would just come in and get a 30-minute massage and some body work. And then, that was a time frame where they could be aware of, oh, I did not realize my glute was so tight. I didn't realize, my chest and my shoulder was so tight. And so it just brings it back into focus. And I think the continual refocusing and then offering the tools like what you did is such a valuable service. And this is very much on the preventative side of things. But man, if we can keep circulation and lymphatic drainage and keep that body healthy, keep those tissues oxygenated, we can prevent so many injuries, but even diseases can be prevented by doing this approach.
Yeah, definitely. I wholeheartedly agree. And I love the idea of being an active participant in your own healing journey. Going into a healing treatment and, just work on my neck. Okay, just do this now. And I feel like there's also an increase in respect when you realize this practitioner is teaching me something. I'm going to utilize their breadth of knowledge and their decades of experience of where are they pressing? How are they pressing it? How are they doing it? What is the result that I feel from that? And how can I then replicate that afterwards? And then seeing, oh, okay, this is how it feels to do it for myself. And also having more appreciation for the practitioner in their skill of being able to do it so deftly and so quickly. And I think it's better for the practitioner and it's better for the patient to learn these self-healing techniques, because the patient's getting better because of all the in-between time. I like to say that your time in the treatment room is but a speck of dust in the grand scheme of your life, but you are with yourself every moment of the day. And in this way, we can truly hone in with our practitioner and get better quickly. And then on the practitioner side, it's fun. It's always fun when your patient's getting better quickly and doing the work that you are offering. But I think having more smaller steps in between to make it easier to go up that ladder versus like just do more walks or drink more water. These are fantastic tools for advice, but there's so much more out there. And I feel like it benefits everybody to learn these skills in between on both sides.
And then you want to find practitioners out there that will recommend, balls like this, or recommend devices like this. I don't know what it's called. These are things that actually make the difference. I got my band. And my only problem is that they're usually stored in the box and I don't use them often enough. And I think that's the problem for most of us, because it's great to have all these devices, but if you're not using them, then it's a problem. And so again, it's individuals like yourselves that remind us that we constantly need to work on the body. I think you mentioned something that's key, Matt. And again, many of my colleagues out there don't even think about this aspect, but that's oxygen. Lack of oxygen is underlying, so many chronic diseases. And if you're not moving, guess what? Your tissues are not being properly oxygenated. They're getting, intoxicated with all the toxins that are not moving around, because motion helps with lymphatic drainage. And then, of course, I mean, you said something very key there, Andrew, is that you get scarring, you get tissue adhesions, and that causes pain. And so the easiest thing to avoid pain is not to stretch, but that's exactly the wrong thing that you want to do. So again, what you guys are doing is so critically important. But I have a question for Andrew, by the way, because there are these devices that are all hyped up. You got one that's called the Hypervolt, which I'm sure you're aware of. I don't know if you're aware of the rapid release device. Those kinds of things. So are these things that people should invest in to help them as well? Because it's one thing when you have somebody else pushing on a ball, on your muscles. It's entirely some different if you're doing it yourself.
Yeah. I can see the value in using these tools. Personally, I prefer to use very simple tools because then it opens the world to the realm of no excuses. I don't have my machine. I don't have my cold plunge. I don't have my infrared sauna. I don't have these things are all great and fantastic, but what about when you don't have it? And in using the ball, I always suggest to use your own body weight and to incorporate it into your life, to just blend it in as a part of your lifestyle so that it doesn't feel like I have to take time out to do this thing. Again, it's great to do those things, but what's the missing link in between is to create the habit. The quality of our lives is the quality of our habits. And if we can build that positive habit, like I've been stretching my leg this whole time that we're talking. I'm using the ball to work on my hamstring while we're talking. I'm practicing energy cultivation and cycling energy through my body while we're talking. So it's the way of implementing it and integrating it into everyday life that helps to build that habit. And then I've realized in recent years, when you don't have a ball, but you learn how to use it, then the world becomes your massage therapist. Things that previously were things that we would avoid, like the corner of a table. I avoid that because I don't want to get hurt. But when you learn how to heal yourself with objects, then that table becomes a tool. It becomes a tool just like a gua sha tool or a spoon or a coin where you can lean into that table, you can lean into that door handle, you can lean into the knob on top of the chair and use that for healing. So now my interaction with the world is a loving place and it helps and heals me versus everything is scary and I must avoid it.
Yeah, what an awesome perspective. Matt, what do you want to add anything to that?
I do, and I love that perspective completely. And I think the key that you've introduced, Andrew, again, is the education side of it, is just this knowledge and the ability to communicate that knowledge. My understandings, what I have recognized is people do want to heal. They do want to take responsibility for their health. It's not enough to say nobody wants to take responsibility. I don't believe that. I think it's just the lack of knowledge and the ability to stack the knowledge according to their ability to understand it. And when we can unpack that and open that up for them, you open up the world, and now the world becomes their healing tools. I love it.
Yeah, and I would add to that too is that we overcomplicate things, and we expect complicated solutions, but the other part is that any of these things, any of these activities, any of these habits may not necessarily offer immediate results. And I think a lot of people get disillusioned or disappointed as well. I mean, I used that ball for 2 minutes. I mean, why isn't it not working, right? So when it really has to be 2 hours before you get the results. And so I think that's the big differentiator. And that's why, the education part is so key. And I'm grateful actually, because I actually forgot, I had this thing, but I was cleaning up my office the other day and I found it. So now you reminded me, Andrew, to start using it and not worry if I'm, moving around during this podcast. Let's wrap it up. Matt, how do people get a hold of you, and final words from you?
You bet. So I have a Facebook group called Healing Healthcare Providers. I have another Facebook group called Vision Quest. This is a course for teenagers. You can reach me also via email, dr.matthew.ormand@gmail.com. And thank you again for this opportunity to have this discussion.
No, thank you, Dr. Ormand. Andrew, final words from you, and how do people get a hold of you?
Yes, sir. You can find me on Instagram at Heal with Andrew. You can also check out my YouTube channel at the same tag, Heal with Andrew. And you can also check out my free masterclass where I'll teach you some of the basic self-healing techniques at backpainmastery.live. You can also check out there, you'll be able to find my my online courses that will give you the top techniques that I've found that will help with chronic back pain. As for final words, I would recommend to give it a try. Try the ball. Try some of these techniques that I'll detail in the free masterclass, and to understand that you will feel something, but to keep it you must put in the work. You must create that discipline. We're disciplined in eating. We're disciplined in drinking water to stay alive. Let's also build that discipline so that we can truly enjoy the rest of our lives without having to. It's never for lack of passion that we stop what we do. It's usually due to pain, illness, and injury. So get started today, and you will be able to live a truly fruitful life free from pain.
Love that, both of you. And I'll add on to that a key insight that I've already known for quite some time about myself. And I love the fact that Andrew, is holding me accountable, even though he doesn't know about it. And that is this, is that I'm a health nut. I've got the sauna, I got the infrared sauna, I got the backboard, I got, PMF beds, I got lymphatic beds, all these different things. But you said something that's very key, and that is that you've got to schedule those. They're complicated. You can't, travel with them. And so with my case, with all these wonderful devices that are incredible, I do forget. And so one thing that I even, with my little timer here, my sand timer, kind of forget, but you just reminded me I could be using this all the time, or the ball, and actually be working on my wellness constantly. And that's the key, keeping it simple, using the corner of the table to do it. But it's that mindset. And one thing that I that's clear is that, Andrew appreciates the need for motion more than anyone else as a dancer, and, clearly educating us. And then, of course, Dr. Ormand, with the amazing work that he does with all of his patients, integrating and unifying all different aspects because of his experience. So I thank you both and look forward to more conversations with you. And, for the listener and the viewer out there, reach out to Dr. Ormand or to Andrew, find out, do his free masterclass, do the vision quest. Our kids need that as well. Thank you both. And my name is Dr. Bart Rademaker. This is the Doctor's Guide podcast, raw and unfiltered, and we will be back.